we're ready to go.
Great, thanks, Aiden. All right, everybody, welcome to Dry Eye Happy Hour. I'm Rebecca at the Dry Eye Foundation, and on the other side of my wall is Aiden, also from the foundation. And today we are doing our panel discussion on MGD. So the Zoom session is in webinar format. For those of you who are more used to the support group format, if you have questions, you can post them in the Q&A. Is that right, Aiden? We do have a Q&A in here, right? And then once we've wrapped up the main part of the panel discussion, we'll open things up to if anybody wants to have their video and audio turned on to jump into the discussion. So before we get started, I just want to give a big shout out to Cindy Edwards, who puts so much work into pulling together great people for these panels. And I just appreciate her so much. And we have terrific people here today. Really looking forward to our discussion. And yeah, we have a relatively young panel today too. And this is the new face of dry eye. It's just starting younger and younger these days, isn't it? So the purpose of our panel discussions like this is not necessarily so much to have a scientific discussion about what is the latest and the be all and end all and the rights and the wrongs, but it's more about how do we approach all this stuff? How do we navigate this world of treatments and information? How do we make our decisions? How do we cope with it all? How do we find the right resources and things? So really looking forward to what will come of this today. So we have Christina, Gabrielle, Tracy, and Ruth, and I'm going to have you each just introduce yourselves with our usual little list of questions of where you are and what you're drinking, when you first started getting dry eye symptoms and why, if you know, where you're at in your journey and what eye drops you used last. And I'm going to just post that too, in case anybody forgets. So let's see. Christina, how about you kick us off?
Okay, sure. So I live in Ohio. My name's Christina. Okay. But I'm currently channeling some Golden Girls Kitchen work vibes. Although I must admit the way this is cutting and cropping me out is very bizarre, so I may end up turning it off, but I thought it would be fun to turn it on. Anyway, beverages that I'm drinking, I've got two today. I'm obsessed with these Ora Bora drinks. Oh, see, that looks awful. You can't see that with the way this is filtering. Highly recommend them, sparkling water, cactus rose, and then I've recently been very obsessed with the cocktail called the Bee's Knees, which is just gin, honey simple syrup, and lemon juice. It's delightful. Yes, very yummy. First started having dry eye symptoms, I want to say maybe 2014, 2015. I was formally diagnosed in 2017, but certainly was likely dealing with it much earlier. So I suspect if I had the wherewithal that I do now, I probably would have been diagnosed in my early 20s. Where am I at in my journey right now? Kind of coming out of a difficult 2 months, at least the beginning of this year, was really struggling with my pain. I still am, but I think that I'm getting better at feeling neutral toward it as best I can. And also currently seeking or will begin seeking what they're calling palliative care support through this organization called Mettle Health, METTLE. I wanted to make sure to plug it because I think it could be a really great resource for this community. I've been saying for a long time, my boyfriend, like ad nauseum, that I think dry eye patients, chronic pain patients deserve a layer of palliative care support. So I'm really excited to get some strategies and coping techniques to deal with living with pain. And then last eye drops I used were Sustain, Hydration, PF. I use those as my day-to-day drops. So yeah, that's me.
Great, thanks. That's what I've had several people recently mention that they were pretty happy with the Sustain Hydration. Yeah, that's really interesting. Are you using the vials or have you tried the multi-dose bottle?
The vials, I just use like one a day, put the cap back on and Yeah, they're just like the right consistency of moist and a little viscous and thick. So I like them a lot. And I've also started using them alongside my Sequa, which has helped a lot with, the pain, at least at night. I don't know why I never thought to do that sooner, but started doing that. I'm very grateful for it.
When you say alongside, like using it beforehand to.
Yeah. So using it like 5 minutes before I do my Sequa to help limit the pain.
Yeah, for those that don't know that trick, that's an important one for any prescription drops that are really irritating, cause a lot of stinging or whatever. Putting an artificial tear in 5 or 10 minutes beforehand can be really helpful. Refrigerated tears beforehand too can be good. Great, thanks, Christina. All right, Gabrielle, how about over to you?
Sure. So I live in Quebec, Canada, in Montreal. So right now I'm drinking simple water. That's what I drink most of the time. In terms of when my symptoms started, it started when I was about 17, so 11 years ago. Back then, it didn't bother me that much, but it still prevented me from wearing contact lenses. My eyelids would just not slide over them properly and wipe them out my eyes. So I guess they were pretty dry back then, but it didn't bother me that much. So I started having severe symptoms, I would say, 3 years ago. So that's when I started having really bad chronic dryness and inflammation. I'm not sure why, but I have been diagnosed a year and a half ago with Graves' disease. So it's an autoimmune disease. So that might play a part in it. So since it started 3 years ago, it has worsened progressively, I would say. So I've pretty much tried all the different treatments that were available where I live since then. So all the usual, Restasis, Xiidra, and I've tried the LipiFlow and IPL, which I've had some not so great experience with in terms of the LipiFlow, especially, I would say. But the IPL I felt might have helped a little. So I'm looking forward to doing another course this fall. In terms of the drops that I use autologous serum tears. And I use right now Hylo Dual. It's a bit strange. So I had brands of drops that I really liked for the past few years. But last year they started burning my eyes really badly for no obvious reason. And right now, almost the only drop that I can tolerate is Hylo Dual. I have no idea why. And recently I've discovered the brand Evolve, which has the same buffer and similar ingredients to Hylo Dual. So this one also doesn't burn. It's a little bit thicker, so I like that. So yeah, that's what I'm using right now. I'm also having to use steroid drops. I've been using those for the last 2 years, I would say, unfortunately, but they do help, so I'm grateful for them. Yeah, I think that answers questions, right?
Yeah, great, thank you. All right, Tracy, over to you.
I am coming to you from Minnesota, and I am drinking 2 beverages. I'm drinking some green tea, and then I am highly addicted to Waterloo. It's black cherry. It's just carbonated water, but I kind of started drinking these like nonstop, and I drink like 12 a day. So, but it's just water, so it's not a problem. But that's what I'm drinking. I first started having dry eye symptoms, I guess, probably in high school, but I didn't know dry eye disease existed. I didn't really I would put a Visine drop in here and there. Never really paid attention to it. My mom had dry eyes, and I just thought I was just going to have to put a drop in here and there for the rest of my life. Things got super serious and exasperated last year in October, following Botox, and then came to find out kind of what the doctors are saying now is my 2 rounds of Accutane, once when I was probably like 18 and then again when I was 27, kicked off severe MGD, and the Botox was kind of the final brick in it that pushed me over. So that was October of 2020. So I've been dealing with it severely for 7 months. Where am I at in my dry eye journey? I have tried everything, almost everything. And I think we're gonna like probably swing around in that later too, so I won't list off everything. But I'm in the acceptance mode. I'm in DBT therapy, specifically regarding how to deal with chronic pain. I'm in group therapy and then individual therapy. And that has really helped me just kind of learn to accept, because that was the hardest part for me in the beginning of this. And then navigating all the, like Rebecca had stated, all the stuff that's out there and what do you do and getting a proper diagnosis. But every day is still a struggle, but I'm able to function, and I wasn't able to before. The last eye drops I used was probably my PRP. I keep that in the fridge. It's nice and cold. But I do also use Sustain. I don't know if it's the hydration, but it says PF on it. So it's something like Christina, I think you're on. And I keep those in the fridge too. And I really like those. And I do that before and after Xiidra, because Xiidra burns. Yeah, I think that's it.
Well, thanks. Talking about eye drops and the names of some of these things, it's confusing because there's a brand name, but within the brand name, there might be things that have completely different active ingredients, right? I mean, like I asked somebody what drops they use and they say Refresh. Well, Refresh has got like 4 different, completely different types of formulations and multiple variations on each theme. To some extent, that's a little bit true with Sustain. I mean, most of them are the PEG and probably glycol, whatever it is. But the hydration one has a sodium hyaluronate that's been kind of gradually creeping into more of the drops in the US market, which makes me really happy because hyaluronate is good stuff.
Good.
Anyway, great. Thanks, Tracy, for the intro. All right, Ruth, your turn.
Okay. Hi. So I'm in England. So a brief hop across the Atlantic. So I'm reasonably newly diagnosed, in that it all kicked off for me on Christmas Day 2020. So last Christmas Day, when I ended up in the emergency department, woke up with a very painful eye and reduced vision in it. After 6 months, we've decided it wasn't a recurrent corneal erosion. It was just really bad dry eye. But in retrospect, I had to give up wearing contact lenses in my 30s. I had an episode of giant papillary conjunctivitis. I've probably had dry eye for a long time, and my body, for whatever reason, and my brain just didn't notice until it did notice. And then when it did notice, it really noticed. So I basically got very severe symptoms very quickly, probably very similar to you, Tracy. I was in and I still am in a bit of a bad place. I'm just starting to come out the other side and get a bit of acceptance, but I'm still off work. So where it came from, probably a bit of predisposition, and certainly my job. I'm a radiologist, so doctor that looks at x-rays and scans. I look at 4 monitors a day for 8 hours a day. And I'm also, I've been told, who knew, a lazy blinker, so I don't blink properly. So I suspect it's been brewing for quite some time. I just had failed to notice through working through a pandemic and being pretty busy. So I've also been diagnosed with corneal neuropathy in my left eye, which is why if I'm not looking at the screen, it's the reason why I'm a sort of a bit sensitive to computer screens still. So in terms of where I'm at, I'm in my treatment. Oh, what am I drinking? Water. So where I'm at in my treatment, I've got some punctal plugs, which have made a difference because I've got quite a lot of aqueous deficiency as well. I'm on a Curvis, which is the EU cyclosporin, which yes, also burns. And I've just had the second IPL treatment. So I've got quite a long way in 6 months, but I suspect that's just by doing a lot of research and being quite sort of forthright and getting seen. So I'm also having some CBT and counselling to deal with the chronic pain aspect, because that is by far, the hardest thing to deal with, I think. And obviously, my next aim will be getting back to work, or if I can't do my current job, adapting it and getting back to work in a way where I can work. So that's where I'm at the moment.
All right, great, thank you.
Oh,
Yeah.
eye drops. Sorry, eye drops.
Yeah.
Hylo Forte. Hylo Forte. I'm a big fan of hyaluronidate. So I use Hylo Forte. I also use something called Eye Drop MGD, which is a Canadian drop, which has got hyaluronidate, some sort of polymer and some glycerin in it for good measure. And it's as sticky as anything. So it kind of hangs around for a while.
What was that called again?
Eye Drop MGD.
Okay.
It comes in those I can't find it. It comes in those really, you know, the really annoying bottles with the little blue dot on that you have to line up. It comes in one of those, which is the major downer with it, but it's a good drop.
Okay. All right. So kind of a echoes of the same theme here, I feel like, with symptoms. You all can trace symptoms back a long ways, right? But at some point, something happens and it just tanks. Sometimes you just fall off a cliff and you've got severe symptoms going on, right? And so I think we've got two of you have had these severe symptoms for some kind of 3 to 5 years, right? And then Ruth and Tracy, who are much more recent, within the last year, even 6 months, where things really got super bad. So everybody's going to come in at this from a slightly different perspective. All right, let's jump into MGD then. And as you can see, I got jealous of all the people wearing their dry eye glasses. I see lots of Siennas there. And I grabbed my Stoggles. You guys ever seen the Stoggles?
Those are cute.
You know, the funny thing is I like them because they're just, I don't wear them all that often, but it's just because they're clear all the way around. Sometimes, I mean, especially like at work with my mask on for the last year and a half, too much stuff on my face, I just get feeling really claustrophobic, but with them being completely clear, it helps. They're not like super close coverage like the Siennas, but they are helpful. All right, so let's talk about when you first, in this dry eye journey, when you first learned that MGD was part of the picture and what the heck MGD is. When did you find out? I mean, kind of in relation to when things got bad, when did you find out about MGD and what were you told about what that means in general? Who'd like to go first on that one?
I can.
Go ahead, Tracy.
I've had quite a journey seeing many different doctors, and it took me months to get an actual real diagnosis, and it took me a really long time to actually understand what the heck I had. But when I had these severe symptoms, they came overnight. I was on a run. I literally took a shower. I got out and I had this horrible stabbing, burning pain, and my eyes were just bloodshot. I didn't know what Meibomian glands were. I never had heard the term. I didn't know dry eye disease existed. I went to just my local eye doctor, and she kind of looked at me and she's like, you have blepharitis, like no big deal, like it'll go away, like, and she sent me on my way with these steroid drops. And the pain was so, I mean, it was like shards of glass. I mean, every time I would blink my eye, just shards of glass. And so, you know, weeks go by and I finally hear there's this dry eye clinic. I'm like, okay, dry eye clinic, they're gonna fix me. And I go in and they kind of look at my glands and he's like, yeah, like you've lost some, people are fine. Like you probably have a mild case. We'll just do LipiFlow. You know, I come to find out I've lost almost all of my glands. But I didn't know it at the time. And they made it seem like I was going to take Xiidra and I was going to move on my way. I didn't actually get an MGD like diagnosis on a piece of paper until I saw like my 5th or 6th doctor. That was like months into it. And so I think that's one of the biggest struggles is like, I didn't know what the heck I had. I couldn't even start researching it because no one even said the word MGD. They just said you have a mild case of dry eye, do LipiFlow. So probably, yeah, early December is when I was actually told you have severe MGD, and I was actually shown. They never showed me it. They took a scan of my lids. They never showed me. And so I actually got to a different doctor and he showed me and he was like, you're missing almost all of them. And I was like, oh, okay. So, yeah.
I mean, I think it's really difficult anyway. So, I mean, I managed to end up going through the eye emergency departments, well, eye casualty, and see 2 people who just go, yeah, you've got dry eyes, have some drops, off you go. And it was only on the third visit with pain when I saw a specialist corneal nurse who went, oh, you've got a little bit of blepharitis, do some massage and heat. And since then, I've seen a selection of optometrists and ophthalmologists of various grades to be told everything from you have significant Meibomian disease at the one end of the spectrum to your eyes look pretty normal at the other end of the spectrum. So it's incredibly difficult to work out where you lie on that spectrum. And it was only when I went to see a specialist optometrist at a dry eye clinic who did the meibomography, I can't even say it, imaged them, where I actually kind of went, okay, well, that gives me, although it's a bit of a gimmick maybe, because it's, you know, you can argue it's what they're doing, not what they look like perhaps, but it gives you something tangible. You can see, okay, so you're telling me I've got grade 2 loss, so I've lost 25 to 50%, and this eye is slightly worse than this eye. And you've told me what comes out of them. I mean, I'm reasonably lucky. My glands aren't blocked. They make mebum. They just don't make very much of it. They're really lazy, basically, but they're not blocked. But it's only, I think, when someone shows you the pictures, you can say, well, okay, I get it. That's tangible. And yeah, I went to medical school. I didn't even know what a Meibomian gland was. I will put my hands up. Eye doctor, but I'd never heard of them. Who knew they existed? And it's only when someone sort of explains how important they are, I think you kind of get it.
Something I hear from people all the time in just kind of listening to stories on the phone is, talk to 5 different doctors, you are going to get 5 different opinions about your Meibomian glands if the subject comes up. How do you deal with these different answers? It's, you know, one says, gosh, these don't look so bad to me. Another says, well, gosh, actually half of them are atrophied. Another says, well, I can get some Meibom out, but it looks like toothpaste. How do you navigate those multiple opinions? I'm sure, Tracy, you had that happen to you. Gabrielle, I see you nodding too. Yeah.
I mean, in defense of my profession, we are always going to have slightly differing opinions. One person's significant is another person's moderate is another person's mild. But I mean, to go from, oh, they look really dodgy to, oh, they're completely normal, it's quite a broad church. It's difficult to negotiate. And I think it's because some people just literally just look at the eyelid surface and go, oh, it looks all right. Not too red, doesn't look too bad. Squeeze it a bit, some stuff comes out. So I don't know.
Yeah, I think there's a wide range in the diagnosis, but also even just what the diagnosis is. Like, for example, one doctor I've been to has said, oh, your problem is blepharitis. And then another one, oh, your problem is allergies. Then the other one is, oh, it's MGD. So and even with each of those, there's a spectrum. So in terms of MGD, the first ophthalmologist I saw said, oh yeah, you have a bit of blepharitis. So if you take care of that, you'll be fine. I'm sure your glands are not atrophied or anything like that. You're too young. And then I went to see a dry eye specialist and had pictures of my gland taken, and they are almost all gone. They're pretty severely atrophied. And she said, oh, you're one of the worst case of dry eyes I've ever seen. So there's really so much in terms of range, and also how much they take you seriously, how much they take your pain and discomfort seriously. Like if you have corneal neuropathy, but your cornea looks healthy, many ophthalmologists will just say, oh, your vision is perfect, your cornea is good, you have no problem, but that's not actually the case. So yeah, there's definitely need to be more education on this topic, even on the doctor's end.
Yeah, what a doctor defines as a problem and what a patient defines as a problem may be 2 very different things. Yeah, because from our perspective, it's usually, I mean, if it's not the vision, then it's pain. And that's what I've been hearing from the beginning of this session is pain, pain, and pain. And that's the driver for us so often to go after these more diagnosis and more treatments. Christina, how about you? When did you first come across the MGD moniker?
Sure. Yeah, I know I've had the opportunity to share a little bit background on that in previous conversations, but not with the same group of people. So actually my experience was the opposite, where the first ophthalmologist I saw gave me my MGD diagnosis. And so it was a 3-hour long appointment. They did the mammography, whatever. They showed me the results. Like, this is like it was just an intense 3 hours, as you can imagine, of like being absorbed into this world that up until 9 a.m. that day, I had no idea I was part of that world. And I know, or I wanted to mention too, leading up to the diagnosis, I would say that as many of us probably do, living in that blissful ignorance, especially being in my 20s where I was experiencing the symptoms, but we're resilient, right? You hear that all the time. Bodies are resilient, they heal themselves. And so I thought, okay, I'll just, limit my contact lens use, switch to my glasses, like whatever's going on, I should be fine. I wanted to mention that detail for context. But anyway, the appointment happens. I meet with this woman who's a dry eye specialist, as we've probably all come across. And, she delivers the message that I have MGD. This is what it is. And this comes up often in these conversations. Well, it's chronic and progressive. And then that's like the final blow. And then it's like, and now that I've told you that, here's a list of 15 things you can do. Hi, it was so nice to meet you. And I was like, wow, this was a lot. I am overwhelmed. I don't know what to think. You're telling me I'm going to live with something for the rest of my life, and it's progressive. What does that mean? Progresses to what? I'm already in this much pain, but how much more pain could I be in? Oh my God, and now you're telling me I have to do all 15 of these things every single day for the rest of my life? So I was processing through a lot of those thoughts in the days and months following. And honestly, for me, the diagnosis was empowering in one sense, because then I could and still do go into conversations with optometrists and ophthalmologists saying, I have MGD. And so I can kind of own that. But on the other hand, I really think that receiving that news that it was chronic and progressive was traumatic. I'm not saying, taking that lightly, I mean that. I had horrible anxiety for months and months. That's what kickstarted me going to counseling. And there were other things going on in my life, but that was such a huge chunk of it. I fixated on it, and I still do, as I'm sure you all can relate. And one other little anecdote I wanted to share too is you just never know how folks are going to react to you having MGD, how sympathetic they're going to be. And I do remember one optometrist I saw, like the appointment I went in, I was feeling really good that day. I'm like, you know what? I have MGD. That's fine. I'm going to own this, and I feel fine about it. So that was who I presented that day to this optometrist. And he was like, MGD, you're not going to go blind, because we were like riffing. But in retrospect, I don't really like that interaction, because it really makes light of the experience that I'm going through. And subsequently, 2 years later, whenever that appointment was, like, yeah, I might not go blind, but I'm in a hell of a lot of pain, as I know all of you are as well. So there's that.
So speaking of pain, then, I think one of the confusing areas in here can be, when we've got all this eye pain, what exactly is it that's causing it? You can't necessarily draw a nice, neat, straight line between the state of your Meibomian glands and how you feel. And many of us have got multiple diagnoses. And, Gabriella, you talked about allergy, blepharitis, MGD, Graves' disease. Oh, there's other stuff coming into play in here. How, any of you like to speak to this aspect of it? How do you feel you have clarity about what the specific cause of your pain is, or to what extent MGD is causing it versus the conglomeration of other things?
I mean, I think it's really difficult, as Christina says, when you go and they say, well, your cornea looks okay and your eyes aren't red. So your eye looks okay, and you're going, but my eye doesn't feel okay. I can't work, I can't do my job at the moment. I mean, I've been housebound, I've been really, I can't go outside. And then obviously the inevitable comes, oh, you've got corneal neuropathy. That's really difficult to treat. And you're going to have a really long and bumpy road treating that. Oh, brilliant. Thank you. So I do think, and trying to have that conversation where they'll go, but your eye looks okay. And you'll go, yeah, but you've just told me my tear breakup time is less than 3 seconds. That's going to hurt. That's by definition going to be incredibly painful, because my eye is constantly being exposed to air, to the elements. And it might look okay, but it doesn't feel okay. So I mean, in terms of my pain, at some point my ophthalmologist has said he'll send me for confocal microscopy, because the rules around prescribing autologous serum drops in the UK are quite difficult and prescriptive. They're on the National Health Service, and you have to jump through a few hoops to get there, and there aren't any private suppliers of it. So then I will find out if I have some abnormal nerves or not. But other than that, it's actually quite difficult to ascertain exactly what the pain is. And in myself, because I've got aqueous deficiency as well, I don't know which is driving what. I don't know whether my tear volume is so low because my Meibomian glands are unhappy, or if my Meibomian glands have just given up because there's no tears on my eyes. And is that low tear breakup time simply because I've got no lipids, or because I've just got no tears anyway? So there's not a lot to evaporate. So it's actually quite difficult, because obviously the two have different treatments, and it's difficult to know which one it is. Hence, I guess I'm going for both. Hence, I'm having IPL, I've got punctal plugs, etc. Just to try and treat both. Who knows what the driver is? I don't think anyone does. I don't think you can, because they're so intertwined, and one will drive the other.
Yeah, Ruth, my tear breakup time, I've been told, is 0. So I feel like that probably was, and it still is, depending on the doctor I'm seeing, depending on the day, I've had like a 2 or like a 3. But my pain was I was also homebound. I was homebound for 3 months, out of work for 4.5. I actually just started my full day back to work yesterday. But as far as the pain goes, I also had the same experience. I kept going back to the doctor, back to the doctor, back to the doctor. They pull my lids down. They're like, yeah, you have severe MGD, but your eye is fine. It's corneal neuralgia, like move along. My pain got so bad, I ended up going to the emergency room twice. The second time I went, they didn't know what to do with me. They ended up putting me on a psychiatric hold, and the emergency room doctor held me down with a flashlight in my eye. And he said, well, your eye looks fine to me, so you must be insane. And then he filed a petition to have me committed to a mental hospital for 6 months, because he was convinced that I must have had some sort of mental issue with my pain, and that it wasn't real. So that was extremely traumatizing. And in the beginning of when this all started, thankfully, and it was also over Christmas, so I was stuck in a hospital bed alone for a week. And anyways, the judge ended up throwing it out, so I was not committed. But that told me that no one is understanding this amount of pain, and that where do I go to get help for this? And where I saw a specialist in Boston, and he kind of just said, I got the confocal done. It was clear. I have no nerve damage. He ran a bunch of neuropathy tests. They all came back normal, but that's also after I've been on blood serum and all these other treatments, months and months. So I'm not sure what that would have showed up like at the time that that happened to me in the hospital. But he just said it was just pressure in my eye, or from missing so much oil. But the pain is so real, and then to not have it validated is really hard. And I think there's a lot of that, even in interpersonal relationships and work. The pain is hard to explain.
So what do you all do to communicate that pain to your doctors? I know communicating with the rest of the world too is a challenge, but I'm just curious, what do you do? How do you get that across? Anybody got a solution to that?
You tell them, but again, I shouldn't be rude about ophthalmologists, but they're surgeons. They're interested in cutting things and lasers. Who wants to deal with chronic pain? some are very good and some are interested, but some haven't gone into it for dealing with chronic pain. I mean, I went to see a chronic pain specialist, and even he said, well, I can't really do a lot except recommend these drugs to you. He said, you're the second patient I've ever seen with a corneal neuropathy. And we had a sensible discussion about different types of drugs and the relative pros and cons, because they all dry your eyes out to a degree. But ultimately, you know, there's not, well, I say there's not a lot he could do. What he has done, and I'm waiting for, is a referral to my local medical psychology department specifically for help with chronic pain management. So I think that will be my take-home message. See someone who's interested in pain as well as someone who's interested in the structure of your eye, because you know, the ophthalmologist isn't necessarily going to be able to help with the chronic pain. That's where you need a specialist counsellor or specialist service. And I think that's the key. And the ideal model would be a dry eye service that is encompassed the medical management as well as the psychological management and the chronic pain management. You know, there's a beautiful potential service there. Whether anyone offers it in your country or mine, I very much doubt, but that would be the ideal model.
Oh, yes.
Why I'm advocating for like this layer of palliative care within dry eye. Like, you know, wouldn't it be nice at the end of an appointment, whether it's the appointment you get diagnosed or whatever, like you are referred to a counselor who specializes in those living with chronic pain, or, you know, you're just directed to someone who works in palliative care in some way. I think that layer of support is so crucial. And I wanted to add, you know, to what Ruth said, I get why, you know, doctors and other care staff don't want to deal with chronic pain, because chronic pain is, I think, so tied to our humanity and our identity, right? When you're living with chronic pain, it affects all of your being. It affects what you are able to do. It affects your relationships with people. And so I think especially within like the US healthcare system, the way it's set up, I just don't think that there's room for maybe addressing those concerns unless you have this kind of like palliative or counseling layer of support. There's just not really any space within the traditional healthcare model. When you go to see your ophthalmologist, there's no space or time for that to be a part of the process, because they are there to treat, you know, medical diagnoses, maybe not so much the chronic pain and how it's affecting your life. So that's why I swear I'm not sponsored or getting paid by Mental Health, but that's why I'm advocating for Mental Health, because I think what they're doing is they're bringing that layer of palliative care support outside of the healthcare system and making it accessible to everyone, so that you can get counseling and support, and again, strategies for dealing with a life of chronic pain. It may not address the pain itself, but I certainly believe that there is a psychosomatic element to all of this. So I will definitely keep people posted on how those appointments go, and we'll share if I have any more insight.
That's awesome. I'm looking forward to learning more about it. I want to make a quick comment or two about pain, and then I really want to circle back to MGD, and we can start getting into treatment topics and things. Just listening to all of you today, I feel like just this level of conversation really is a mark of significant progress in our community, because I'm hearing the word pain over and over and over. That didn't used to be the case. Pain wasn't talked about in the medical world with dry eye. It was always, you know, symptoms, dryness, irritation, discomfort, and all of that. But I think as a community, we're getting more conversant and more comfortable with the idea that all of these symptoms are pain, whether we've got light sensitivity or burning or whatever our symptoms are. These are pain, and we get to present it that way. And I'm also hearing in kind of both in the medical world and in industry, they are referring to this more now as ocular surface pain, which really excites me, because those are the terms we need to be talking about it in, to just call things what they are so we can start getting closer to solutions. Okay, home remedies just steering back to MGD here. How many of you have done like the home remedies? Is it heat? Is it lid hygiene? Is it drops that are specifically for MGD? What things that you can do on your own have you done, and to what extent have they helped with the MGD?
If I can.
Yeah, please.
So I think for me, the eyelid hygiene has definitely been very helpful. So once I've seen a real dry eye specialist, I was recommended some eyelid wipes that are specifically made for MGD. They have tea tree oil in them, so I use those every day, and it has definitely helped. When I first went to see an ophthalmologist, I was simply advised to use baby shampoo and warm compresses, which were really irritating. I mean, the warm compresses were helpful, but the baby shampoo was not a good idea. So as I learned more about the condition and did more research, I found out that it's much better to use a product that's specifically designed for this purpose instead of baby shampoo. So once I started doing that proper eyelid hygiene, I got rid of the blepharitis aspect of the condition, so that was really helpful. I still have a lot of inflammation of my eye itself, but inside the eyelid, the inflammation is pretty cleared. So I'm really happy about that. So I do the warm compresses also, and I also do a lot of cold compresses. So I guess it would be included in the home remedies. So especially for bouts of allergies, or if I'm just in too much pain and I need a break, a cold compress is often very helpful. It doesn't last long, obviously, but it's a nice break. It gives you time to recharge a little bit. So that's what I'm doing in terms of these types of home remedies.
I love that. I love cold. Who else has been told to use baby shampoo to wash the lids? Okay, well, Tracy and Ruth lucked out, because I mean, most people get told that somewhere along the path. It's the old conventional advice, and it's now, I think, scientifically pretty outdated. But how many years does it take before newer science really supersedes older science in ordinary clinical practice out there? It's a long time.
I can't confirm the doctor who told me that was, in fact, very old and was very close to retiring. So it makes sense. But I have kept up with it, because I just see it as like, maybe it's not helping, maybe it is, but it's, like washing your face, but I'm like just washing my eyes. So
I think the concept of lid hygiene can be really super important. Just a question of, what is it that you're using, and does it work? Does it help without hurting more, and all that? What else are the rest of you using to doing just kind of in terms of home remedies, or things that you've tried in the past?
I think when I was first diagnosed, I think I discussed it with you at the time, Rebecca, I had tremendous pain in my eyelids. My eyelids drove me absolutely nuts, and heat really bothered them. And it took a while until the cause of that was ascertained. I had a lid wiper epitheliopathy as a manifestation of the dry eye. So just underneath the back of the eyelid was very inflamed. And it's taken a couple of courses of steroids and the cyclosporin, and now that has died down. I can tolerate heat, but I still really struggle with those rice bag things, the direct heat. So I use the Blephastine, so these goggles, which I don't know if you can get these in the States or not, or whether they're made in they're a French company. So they give warm, moist heat. And I mean, you look like a bit of a crazy person in them, but they're very nice. And they obviously, it's like being it's like little mini saunas for the eyes. So I find those quite soothing. And I use, again, I buy it from Amazon America, Avanova spray, the hypochlorous acid spray. I find that really nice as well. It's a good cleanser, and it's quite gentle. It doesn't sting. Because I found tea tree oil for me really stung. I couldn't tolerate it, but the Avanova I really like.
I do have a tip on the Avanova, because I was buying the tiny little bottles on Amazon for whatever, $30, and I was flying through them. But a dear friend of mine told me you can actually get a prescription, and it's from a pharmacy in Florida, or at least the one that I use, and they ship, and they send you free wipes with them, and they're actually like like big bottles of Avenova and way cheaper. So if anyone, and I just asked my ophthalmologist for a prescription. Maybe everyone's already doing that, but I didn't know. But I was like, yes, no more tiny little bottles on Amazon. So so that helped me too, Avenova.
With
And
international shipping, I think I'm stuck with the tiny bottles. But
oh yeah, yeah. And they send these nice little Avenova branded wipes, and it's nice. I use a USB heat mask. I found that's the best one that I've found. It's a brand, Aroma Seasons. It doesn't have aroma in it. I don't know why it's called that, but that's on Amazon. I use that 20 minutes in the morning, and that's kind of my reset to kind of meditate and set my intentions for the day. But I love, like Gabby, I love the cold compresses too. I use them in car rides, on road trips, when I'm done with work all the time. It's very soothing. But I did try new lids. I don't know if that's considered a home remedy, but I found that too irritating on my lids at the time. It was too painful. But I might try that again now that I've got my pain a little more managed, just to kind of keep the lids clean. But yeah.
Anybody else here tried new lids? Just out of curiosity. No, okay. And going back to the blephostine that you mentioned, Ruth, it seems to me I saw somebody on one of the Facebook groups the other day complaining about the fact that nobody could get them anymore. I don't know if they're still on the market. I don't think so.
You can't get them in US for sure, because I've tried.
Okay.
Oh well, if this ever breaks, then I'm in trouble, because I love it. Oh no. That's hopefully they'll bring out kind of blephostine Mark II or something.
I would hope so. I mean, with the demand out there, you'd think anything on the market for dry eye and all of this would be propelled forward. About those big bottles of hypochlorous, I kind of think maybe it's, with the pandemic and the massive increase in need for products for sanitation and things this last year, that's why everybody everywhere is selling hypochlorous in different forms. I remember that like last year with a lot of medical offices just kind of trying to adapt and things. I remember looking at some of those and thinking, gosh, that's a heck of a lot cheaper than Avenova. There's a lot of different forms of hypochlorous out there, which is great. All right, any more on the home remedies, or any other like favorite forms of warm compresses?
I'm going to just offer my alternative perspective here, which is that I will opt out of this question with the caveat that I'm still very indignant about the daily routines. So I wanted to speak up about that, because I'm sure I'm not the only one. I'll call myself punk rock. I'm just like, okay, that's cool. I got all those things I can do, but I don't know. I'm going to be a little rebellious today. So honestly, a couple years into all of this, I'm still personally trying to figure out a day-to-day routine. So I find everyone's suggestions to be very helpful here and also on the Facebook group. I'm just personally still struggling with the concept of revolving. I see it as revolving my day around managing my pain and my symptoms. So that's why I get a little punk rock about it.
I'm with you on that, actually. The extent to which I'm able to actually keep up a routine is not so strong. It's the last thing I want to be doing. Wow. Okay. Let's move on then, just looking at the clock here, to the big guns. There's all those lovely, not covered by insurance procedures and things that we can get done. There's the LipiFlows and the IPLs and the probings and the Blefx and the iLux and the Meiboflow and I don't know what all. I think just whoever would like to jump in there and talk about their experience, go for it.
I mean, I'm in the midst of IPL at the moment. I've just had my second session, so I haven't had LipiFlow because I don't have blocked glands, so there's nothing to unblock. So I didn't see the point of it. As in, I did have manual expression instead when I was first diagnosed, which does the same thing, isn't it? It's just squeezing. But I've had 2 sessions of IPL now. And my tear breakup time has actually gone up a little bit. So it's gone up to 6 from less than 3. So maybe it's the punctal plugs, maybe it's the IPL, but 6 is good. So I don't know if it's working or not. I've been told not to expect miracles after 1 or 2 sessions. I've been told it will take a minimum of 4, probably more, given how little oil my lazy glands do make. But I think it seems okay. I mean, it's a bit, I'm assuming some of you have had it as well. It's a bit freaky being able to see the light despite the shields because it's so bright. It is slightly unnerving having it done. But, and again, given that I'm a scientist by trade, I know the evidence for it is actually not very good. There is lots of evidence out there, there's lots of trials out there that say it works, but there was a Cochrane Library review of the evidence saying the trials were not particularly good, so the evidence is actually not that strong for it to work. But the reason I had it was there is enough evidence out there. Okay, it wasn't a particularly well-designed trial and there's not much, there's only a couple of randomized controlled trials, but there is enough evidence piecing it all together that it probably does work. And my ophthalmologist said, the only thing you have to lose is your bank balance. It's not going to hurt. So I figured I may as well give it a go anyway. Even though the science is not strong, I think there probably is enough of it to say, yes, it does work, having reviewed and read a lot of papers on it. So I was happy to go for it and try it. And it possibly will get rid of some crow's feet as well. So, unintended consequences. So I will have to keep you posted based on what happens on my next few sessions.
Yeah, I'd love to hear. I love that you brought up Cochrane reviews because, on all of these things, there's just a gajillion studies out there at this point, and anybody can quote from any study when they want. But in the Cochrane reviews, I don't know if you're all familiar with those, they're coming in, gathering together all the studies and then subjecting them to a really close review. And finding which of them are similar enough that they can actually be compared and weeding out the ones that just have a really poor quality, and coming to some conclusions about what we know and we don't know on these different topics. And in the whole dry eye arena, I have to say, my experience with the Cochrane reviews is so much of it is that there just aren't a whole lot of really strongly positive answers on things. I mean, even for the blood-based products and things, there's just a lot of big question marks. What works for whom and why? There aren't broad brush solutions.
One of the procedures that would really need more evidence is the intraductal probing, right? So this is one of those that has scientific papers from almost just a single doctor. So it would be really nice to have more of those reviews on all these procedures, especially the newer one like probing. Personally, I've done 4 IPLs as well. A bit similar to Ruth, I'm not actually sure that it has helped, but at least it hasn't hurt. I think for me, I would need to do more. So I plan to do more this fall. I'll probably do 4 more. I've done first, before IPL, I've done Lefex and LipiFlow. I did have a bad experience. I think I hinted to that at the beginning with LipiFlow. So I think this is something that the doctors are not really aware of. Maybe I'm a rare case, but for those that have very small eyes, like my eyes are proportional to my face, but apparently I have an extremely small face because I have tiny eyes, and the eye cups that go under the eyelids really did not fit well. The technician had so much trouble putting those in my eyes, and it was very painful actually, and it ended up causing some damage on the conjunctiva of my right eye, and it's still more problematic than my other eye still today. So I think it's 1 year and a half later, I still feel the difference. So because there's so little data, so few people that have had these procedures, it's hard to know that these things can happen and what to watch for, like the size of your eyes, or if you have any other conditions that are a contraindication for the procedure and things like that. So yeah, definitely having more of these large studies, these large reviews would be extremely helpful.
And getting some more attention to just case reports on individual things that go wrong to raise awareness too, like yours. That's a new one for me. And you guys are just talking about, how do we find things that help, that may help but won't hurt. And sometimes there's things that we think, well, that can't possibly hurt, but there's exceptions. And
I had even asked the doctor first. I said, I know I have small eyes. Could that be a concern? And she said, no, it shouldn't be. This was tested on Asian eyes, which are considered to be smaller, and it was fine. So you should be fine too. And it turned out to be a problem. So I have no way to share this so that the other doctors are aware of it, or so yeah, the reporting definitely needs to be done more thoroughly. Yeah.
Gabby, I had LipiFlow as the first procedure I ever did too, and that was with the first clinic that never ended up showing me my scan. And they said, oh yeah, everyone does great. You probably won't need this again in a year. And I said, well, what are the risks? And they said, nothing. It's like a facial for your eyes.
Exactly.
You know, and I'm sitting in there and I thought, okay, now I wasn't a candidate for LipiFlow. I don't have any glands. There was nothing was clogged, but I didn't know this at the time. And they put it in my eye and it hurt. It hurt really bad. And I kept saying, it hurts, it's hot. And they're like, no, like you're fine. And that will always be my biggest regret, that procedure, because that kicked off the pain that sent me into the hospital. I mean, I had pain before, but nothing after that. And I kept calling up to the office. I said, something is wrong. Like something happened with LipiFlow. And they said, no, this has never happened. Everyone loves it. It's comfortable. You're the only person that said that. It's not LipiFlow. It's your coronary neuralgia. So that I still have, I have consequences from that still. But to piggyback on that, I've done a lot of other things in my 7 months. I went and did with a doctor in Maryland, I did probing and PRP injections. And that was very interesting. I do feel, although, there's not a lot of studies backed up behind it, that's when I started to turn a corner with my pain. That procedure was a very lengthy procedure. It was a painful procedure, but when I got back, I started to feel a little bit better. I have done Meibomian twice. I have done IPL 4 times, and I have my 5th one scheduled next month. I feel like IPL helps me. I've been told I have ocular rosacea, but I've also been told by 3 other doctors that I don't. Apparently it's supposed to be good for ocular rosacea. I don't know. It is what it is. I have found that I think IPL helps me probably the most. The probing, I don't know. It's scary. It doesn't have a lot of, like you guys had said, studies to back up, but I felt like I had this time off from work that I just wanted to try it while I could and travel and see these specialists. So I did. But as far as the future goes, I'm just sticking with IPL and kind of see how stuff settles. So.
Just a little question for you. Did you have the kind of IPL where they put eye shields under your eyelid, or just the sticker?
Yes, okay. I've actually had it. I've had it both ways. I went to my regular doctor because I wanted. So I have basically no glands on my lower lids. I have about 1 working on each side, but I have several on top. So I was like, I wanted to get some light going on the upper lids. Let's try to save these babies. So my one doctor only shot the light on the bottom lid. So then I ended up going to the different doctor who had like the iLux, or not the iLux, but the Luminous 2000 or something.
22.
Yes. So then he put the fun, weird alien like metal shields on my eyes and, went to town on that. But when I was getting just the lower lids, they just kind of put this weird, almost like a tape over my eyes. It wasn't the shield. So I've had it both ways, and
yeah,
who knows?
Yeah.
It's very expensive. That's another thing. I'm like, can anything be covered by insurance? Just like one thing.
Right,
I'm
across a bone, something.
Yeah. And I don't know, Rebecca, if this counts as in-office procedures, but I was on blood serum. So I did that for several months. But then when I had done the PRP injections, I thought we'll switch over to that. So I've now been on PRP, platelet-rich plasma, for those who don't know, for about 3 months now. But I'm considering starting Regenerize. Has anyone tried that in this?
I've heard of it. I actually spoke to them on the phone the other day, and mainly because I was just being that person. I cannot find a single randomized controlled trial about your product. Have I missed it, or does it not exist?
No, there's no
Can you
real.
be
Yeah, I
speaking-
missed it.
No, I haven't missed
Oh.
it. So he he then gave me some advice on if I wanted it from the UK, how to get it from the UK. But I and the cost of it. But I'm probably just going to hang on for autologous serum drops here when I eventually qualify. When I've been in pain for 12 months is the answer. Yeah. That's when I'll qualify. Yeah, I'll probably hang on. But I mean, it kind of made sense as a product, because it's got, you know, cytokines and growth factors and good things in it.
Somebody told me they're saying they can regenerate Meibomian glands by it, but I don't know.
There's not even a real study on that. I've looked it up. I mean, there's kind of a little white report, I think, by the company that is saying that, but there's no actual evidence and definitely not a real paper on it. So yeah, it's quite a claim to make.
Things that have come across that's, oh, sorry.
Yeah, I just wanted to say I've tried it because I didn't feel there was enough evidence, but I felt I had nothing to lose, so I tried it. It didn't work for me. It really burned my eyes, made them red, so I had to discontinue it. I feel that the serum drops are more helpful for me, but I've heard other people saying the Regenerize helped them, so I think it can vary quite a bit between people.
For something that doesn't really have any published studies, it's remarkably well known right now. I mean, I just hear about Regenerize from an awful lot of people. Christina, where do you stand? Can I ask, with all this in-office stuff?
Thank you for asking, Rebecca. I'm listening intently and you know, thinking how I'm going to formulate my response, especially now that I'm almost done with my drink. So with that, I am a less is more person. I remember in high school reading this book called The 100-Year Lie, and it was about all of the chemicals and now I can't think of the word off the top of my head, but it basically just covered ever since the Industrial Revolution, like the effects of the Industrial Revolution on, you know, what's put into our bodies. And so I remember feeling at the age of 17 or 18, like, that's screwed up. Like, I don't want to take, if I have a headache, I'm not going to take leave for it, you know, like, I've kind of spent the last 15 years or so of my life kind of bulking against any sort of treatments. And again, like this less is more approach. So as far as my journey with dry eye specifically, I have gotten LipiFlow twice, and that's it. Other than, I guess, I had done, or I had taken Xiidra or Zedra. I can never remember how to pronounce it. I did that for a little while, but then after the coupon expired and we've all been complaining about the out-of-pocket costs, I felt that $280 a month or whatever was not a tenable price point for me at that time. And I've been using Cequa for over a year. But I guess we're talking more about treatment. So yeah, LipiFlow is all I've done. The first time I got it done was that doctor I'd mentioned, was at the practice, that doctor I mentioned earlier, the one who provided my diagnosis, because in addition to chronic progressive, here's a list of 15 things you can do. Then the follow-up was, I highly recommend LipiFlow. It does this, blah, blah, blah. And I was like, I'm vulnerable. please, yes, anything to prevent or limit the issues I'm going to have. Oh, it's $1,500. Well, it's $1,400, $700 per eye, plus an extra $100 for the Bruder eye mask and the omega-3s. And I was like, yes, $1,500. Please help me. So that was my first experience. I feel like my vision improved a bit. I don't really remember now at this point how my symptoms or my pain, how my experience of pain was at that time. And, I think too, part of that process was like, well, doing this once a year. I think Tracy, you had mentioned hearing that cadence as well. But when at the time I think I was only working part-time in retail, and once a year, $1,500, $1,400 to $1,500, again, untenable. So I was like, well, I can't, that feels impossible. You seem to be wagging a solution in front of my face, but I can't keep up with it. I can't afford this. I make $2,500 a year. I mean, I can afford it, but I have other expenses too. And then I did find a local optometry practice that offers LipiFlow. I guess they have some sort of, is it Johnson & Johnson that LipiFlow is now owned by? I don't remember, but they must have some sort of program that offers discounted rates for optometry practice. I'm sure they're trying to get into the game of dry eye treatment as well, and make money where they can on that. So it's only $4.95 at this practice. So I did do I guess was it already 2 years ago now? Negligible. I don't know that it helped. And then with that, I will just say, I also wanted to mention that at the beginning of the year, I was feeling pretty hopeful because my optometrist, again, they have LipiFlow, so they can speak to dry eye and MGD and they can get the scans and everything. So they did my tear breakup time, and I want to say one eye was 10 seconds and the other was 15 or something. And I was elated. I was like, wow, these are great readings. The LipiFlow must have helped. Sequa must be helping. But at the end of the day, I'm in the worst pain I've been in these past 6 months. So if my tear breakup time is good, it hasn't necessarily improved my pain. So that's where I'm at. And I think, to everyone's point, there just needs to be more trials, more research invested in what works and why, or why not. Are you a good candidate for something? Are you not? I think there's an ethical responsibility. Tracy, I'm so sorry to hear that you were recommended LipiFlow. It just feels unethical. Maybe they didn't do the reading of your glands, but
No, they did.
okay, well then it seems unethical personally.
Yeah.
Suggest that to you.
Yeah.
So, yeah.
Cynics would say there's an awful lot of money to be made from Meibomian glands. I think it's probably worse your side of the Atlantic than here. We don't tend to have as much. I've not seen anywhere that does LipiFlow here, for example, but certainly from having a dabble on various Facebook, Twitter accounts, just doing my research on what's happening in the States, there's just a huge industry. Is that my impression correct? A lot of stuff to be done, and whilst a lot of these things work for Meibomian gland, I'm not sure they would work for everybody's dry eye, for example. And as you say, it's patient selection, and certainly someone who's predominantly aqueous deficient rather than Meibomian gland deficient, these things are probably not going to necessarily help quite as much. So I do wonder whether it's being offered as a cure-all for dry eye as opposed to a cure-all for Meibomian gland dysfunction. I don't know. It's just sort of an outsider observation.
Well, I do want to share, to the credit of the current ophthalmologist I've been seeing, the first appointment I had with him, he's a very good listener. And I was telling him my whole spiel and everything I've been through. And I remember him saying, like, I went to a conference, ophthalmology conference, and they literally had a session on how to make money off of dry eye patients. I mean, maybe it wasn't so crude, but
Well, I've been to one of those myself.
that's
I
right.
saw those presentations.
This,
Yeah.
this has come up in a previous conversation, Rebecca. And so I really appreciated him sharing that, being honest about it, and saying, I'm not going to do that to you. Like, we don't have LipiFlow here. We don't have anything else, because I believe that it's manipulative, whatever his words were. Like, I don't feel that it's appropriate to have those in my practice. So.
You know, I have all these mixed feelings about LipiFlow, because on the one hand, I really respect the science of it. And honestly, I know lots of people that have actually benefited a lot from LipiFlow. But on the other hand, it's almost like a victim of its own success, because it's been so overutilized for people who can't possibly benefit, that it's really damaged its reputation in social media and everywhere, because there's so many people that got it and it did nothing for them, or got it and then found out later that they really weren't an appropriate candidate for it. So, but I think we tend to target LipiFlow partly because it's like the big expensive one too, right? So you can't avoid having your expectations a little bit higher from something that you have to invest that much in. But with all of these things, it comes down to, where's the science? Where's the data? And if it's not showing clearly that it benefits the majority of us, then who does it benefit? How do we narrow down and figure out who's going to benefit? Yeah, we got a lot of work to do. I feel like there's so much to talk about. I want to do an MGD 2 session.
Yes.
Sometime soon. I'm just really quickly going to run one quick question by everyone, and then I'd really like to open this up to anyone who wants to jump in and join us. I see we've got several people here. So our last thing was, what do you wish you'd known earlier? In whatever struggle you've gone through, or for however long, what do you feel like would have helped you a couple years earlier or a couple months earlier? What would have helped? What do you wish you'd known?
I was chatting to my counselor, my therapist today, and I was saying, if I could jump in a time machine and go back 5 years, I would say, learn how to use a computer properly, take proper breaks, blink, for the love of all that is holy, blink. And she said, you sound like you're blaming yourself to a degree for all of this, to which I said, yes, I am. And she said, if you'd have gone back and told yourself 5 years ago, blink, would you have done it? I'd have gone, no. I'd have just gone, and I had to go at my blinking exercises for a day, and then gone, well, you know, my eyes are fine. I don't need to do this. That's human nature. So what I would have done is go back 5 years and go blink, and then gone back 4.5 years and gone, are you still blinking? Yeah. So I think my take-home message is, someone whose job has been incredibly digitally orientated is basically just learn how to use a computer safely for your eyes, I think, is my one sort of take-home message that I wish I knew, if I knew then what I know now.
Similar to that, I wish I had known about this and the impact of the computer use much earlier. I think I would even have chosen a different career path if I had known. And if the optometrist had access to those machines to take the pictures before. So I mean, it's not their fault that it wasn't available, but the atrophy takes a long time to happen. So I mean, for those of us that have almost no glands left, if we had known earlier, if we had seen those pictures when they were not as bad, we could have changed our habits a little bit, done some better eyelid hygiene earlier, been more conscious about computer use. That's what I wish I would have known. So I would have dropped all the video games and studying 24/7 for my studies and everything. So yeah, I think that could have changed a lot of things. It could have prevented some inflammation from setting in, stuff like that. So yeah, definitely just knowing sooner and being diagnosed sooner is what I would have liked to hear.
What I actually said to the therapist was, I would go back and say, don't be a radiologist. It's really bad for your eyes. Go into public health medicine. There's an academic.
Yeah.
I think I think for me, just knowing, I mean, not only, and I know I've had several doctors tell me, you know, they're still learning about the Meibomian glands, you know, 15 years ago, maybe some of them weren't really focused on that, but I wish I would have known how serious this disease was. You know, you go to Walmart, you go to Target, you see 85 different eye drops, Visine. It's very casual. Put a drop in, you're going to be fine. I didn't know, you know, I also, Ruth was, I mean, it's still my job. I'm an analyst. I'm on computer all day long. And I never thought about it. I put a drop in and I thought, well, I can work 8 more hours. I didn't know this disease existed at all. So I think even education, I mean, you know, if you smoke, you can get cancer. If you drink, you're going to get liver disease. I mean, there's all this other stuff that has all these warning labels on it and all this stuff. And it's like, when I walked into my first dry eye appointment, I had no idea. When they said disease, I was like, what? Like, I've literally never heard of this. I don't know anyone with this. And it wasn't, yeah, if I could go back of just knowing how much damage I was doing, A, with the Accutane or the Botox, but also just the technology use and all that, I had no idea. And I think our society with the word dry eye, like Rebecca has always stated, ocular surface pain, kind of communicating more of what the real issue is. It's generalized and it's not considered like a real disability and it's not taken seriously. I didn't take it seriously either. I didn't know. So I wish I would have known.
You know, I think, Tracy, to your point, and Gabrielle also being a younger sufferer, I think and Ruth, you were young once. We were all young once. And, you know,
I'm not young anymore.
Your spirit is young. But, you know, we expect young people to make these, you know, like student loans, right? Like, you're expected to make this very mature adult decision at 18. And isn't it like, doesn't it take till we're 25 for our brains to fully develop?
Yeah.
Like, why are we presenting certain decisions? In this case, I guess I'm thinking, you know, certainly my own journey is like contact lenses. I didn't mention it earlier, but I strongly feel that contact lens abuse, as I call it, is the cause of my MGD. So, you know, just like every optometry appointment, remind me, because I am literally a child, remind me at every appointment, proper contact lens wear. I'm not saying that I necessarily blame my optometrist. I'm just saying, like, that would have been nice to hear that reminder every time. Although perhaps he did. I don't know. My memory's awful. But just, yeah, you're young, you're underdeveloped, and you are given the option to wear contacts instead of glasses, or you're given the option to not have acne, so you take Accutane. Like, of course you're going to take Accutane. But that messes with your body. Contact lenses mess with your body. Anything you put in or on your body can have an effect. So all that to say, you know, for me personally, if I could go back, take your contact lenses out every single day, you dummy. Like, okay. But I can't go back. But that's certainly something I ruminate on from time to time. I would say post-diagnosis, use the warm compress every day. I do have concerns maybe about using the heat over, you know, a lifetime, what effect that could have on the eyes. But I do think that had I started it day one, you know, I wish I would have stuck with it. Just, it could have helped a little bit. Maybe I wouldn't be in quite as much pain now. I don't know. But it seems like in the grand scheme of things, that 10 minutes a day really isn't a lot of time. And I'm worth it, right? And it's 10 minutes to like zen out and listen to music you like, or listen to a podcast. So I wish I would have started doing that sooner and with greater frequency. And then I would say, and maybe I've mentioned this in previous discussions, and this is just for all practicing optometrists, is do dry eye tests. Test for people's tear quality. I don't recall that ever being a normal part of an annual optometry appointment. So if every optometrist could just incorporate some of those preventative tests into those annual appointments, I think more people could receive the diagnoses and be empowered to know that they're living with these conditions. And I think it would just help with that awareness and education piece if they were to do that.
I love that. All right. Thank you guys so much. This has just been amazing. You've all been really lovely. And poor Ruth here, it's like, I don't know, 20 minutes after midnight where you are.
I think I'm actually going to sign off now because I'm going to turn into a pumpkin imminently. So thank you for having me, lovely American cousins, and enjoy the rest of your discussion.
Great to meet you.
Thank you so much, Ruth. Good night. All right. Well, thank you to all of you. This has just been really amazing. Like I said, we've got to have part 2 sometime soon here. And I'll be remembering our Dry Eye Coalition too. Aiden, I'm going to pass this over to you to see who would like to jump in and join us.
Yep. So I know, Barbara, you've got your hand raised. Anyone else who'd like to join with video or audio, just raise your hand.
Well, I just loved that, I don't know, things like trauma and counseling and therapy just kind of came up over and over today. This is a big part of our reality. This is what this condition does to us. So just love seeing the open dialogue about it.
Hi, everyone. It's Barb.
Hi, Barbara. How are you?
I'm hanging in there, better today than I was yesterday.
Yay.
Yeah, I'm just lots of questions. You know, I'm kind of new to this thing. I did go into I do have MGD. I was diagnosed. I went in and actually finally had the testing done after 20 years of having dry eye. My area of loss in my Meibomian glands are about 50%. Right eye, 49% is the area of loss. And then on the left eye, 58%. So about half. I did the BleFX treatment. It seemed to help at first. I don't know. I don't really know how much it helped. Struggling with a lot of just, you know, what do I use? What works? What is damaging? What is helping my eyes? You know, I heard somebody talk about the hot packs, the moisture little, you know, things you put in the microwave. I don't know, but when I get up in the morning, I'm trying the tape. That I'm struggling with that. It kind of makes my eyes puffy and irritates them. I backed my old cheap little watery little drops I put in before bed, and then I wake up and my eyes are pretty bad. And then I get into the Restasis. You know, I put the glaucoma drop on the right eye, and then I have the Restasis go in. And by the time I get to work, my eyes are like sore as heck, you know, over then through the day. If the air conditioning isn't blowing on me, they pretty much recover pretty good. I put drops in the office, just the regular drops, not enough. And I'm glad somebody mentioned about the computer and taking care of my eyes a little bit more to prevent the progression from getting worse faster. So struggling with a lot of things. Yesterday was terrible. And the one thing someone asked earlier about what else contributes to this disease or this pain. And for me, it's the spring is terrible this year. The pollen is the worst it's been since 2014, I'm reading. And all that stuff floating around in the air, of course, gets in our eyes. And then that can really, really cause some problems. I went for a walk the other day and oh boy, you know, little bit of wind. And the next day I'm all a mess. Looking into, I'm going to have to get those moisture chamber glasses, a little concerned about that with my progressive lenses and just a lot going on. And in the emotional part of it, you know, this really sucks that we have this and, you know, it's a lifelong thing. And I love being outside and going for walks and all of that. And I think with those chamber glasses, maybe I'll be able to do that a little more. I don't know, my eyes are better today. So just got to put the air conditioning on. And of course, that's going to be an issue when the air dries a little bit. So just just like to listen to you guys and know that, I'm not the only one. And, there's an emotional piece to this and hearing about the products. And so I don't know if anybody has any ideas about what works the best. And we've kind of talked about that a little bit, but basically the night thing, I think if I wake up and my eyes are already irritated, then it takes them a long time to get unsore, and then they're red at work and I'm crabby and I'm irritable and people don't understand this. And I know you guys do. So that's great. So that's kind of where I'm at. Other than that, just trying to keep moving forward. Oh, my evaporation times are my right eye, it's 2.9 seconds. My left eye is 8.3 seconds. And the right eye is the eye I have the glaucoma in. So yeah, lots of fun. So that's all I got today.
Thanks,
Thanks for
Barbara.
listening.
Right. I'm just, something you're saying about the emotional part of it. I can't remember the wording that you used before that. It was making me think of what you were saying, Christina, earlier about just the traumatizing impact of the language that's used around dry eye disease, the chronic and progressive lingo, and what that translates into, and what a doctor means by that may be a very different thing than what we internalize that as, because when we talk about dry eye disease, doctors thinking about what they see through the slit lamp on the surface of your cornea. We think about it in terms of pain and what it's doing to our lives, our work, our driving, our social lives, our relationships, our everything, overnight, sleeping through the night, all this stuff. So it's talking about it in those terms makes us take those types of impacts and extrapolate them out into the indefinite future, which just emotionally can become intolerable. So it's one of those things where I'd like to see our doctors getting more education on how to talk to people with dry eye disease, what to say, what not to say. Or, one of those classic PowerPoint chart things where you said this, they heard this type of thing, we need some of that.
Well, I think the other thing too is the hope. I need hope. I need hope to cope, and it's the anxiety of, oh boy, how bad is it going to get if I'm 80, 90 years old? What am I going to be like then? And I just can't go there. It's got to be a day at a time, and to do the best I can, find the products that work for me, and ask you guys questions. And we're all in this together, and just help each other to find solutions. And I have to stay out of the future. I just have to deal with today. That's all I can do. And that helps me the most, I think, with that emotional part of it.
Yeah, Barbara, I think at one point I was minute to minute. I think I used to call Rebecca and she was like, well, if you're just going to do minute to minute, that's where you're going to be at. And I had to do that for a while. And now it doesn't have to be exactly minute to minute, but yeah, the future is ominous and scary, and you just have to focus on day to day, and that's okay.
Just one quick question, you guys. Dry eye glasses, the moisture chamber. How much is that worth it? Are they really, really, really beneficial, or where are you at?
Oh yeah. Sorry, for me personally, I've traveled to see several doctors, so I've flown on several airplanes, and it's priceless for me. Going outside and not having the wind blowing in my eyes, if I want to sit on a patio, or they don't completely block it out, but it does enough a barrier for me where I feel like I can go and interact. And I usually wear them when I'm working on the computer, and it's been priceless for me.
It helps me as well. It's not perfect. They don't still perfectly, but I definitely couldn't do without them. They're definitely not enough to feel normal or anything like that, but it would be much worse without them. So I'm glad these are available to us now. Yeah.
I think they're a really essential apparatus. I remember when I first put on a pair of 7-eye air shields, and this is more than 15 years ago, and I was in Florida. I've probably told this story 1,000 times, but it just, for me, it was profound. It was like I suddenly realized how many things I was avoiding because of my eyes being so uncomfortable. Going outside for a walk with my toddler at the time, simple stuff that I was avoiding that I didn't even realize. Once I got those glasses on, I mean, I didn't care what I looked like. It's like, wow, I'm comfortable. I can walk through the doorway of one of these big box stores without flinching and cringing and wanting to run away. It's having those environmental tools, I think, is important. We just gotta advocate to get better ones. We need moisture
Cuter
chamber.
ones.
What's that?
Cuter ones.
Yeah.
Cuter ones.
Yeah, no kidding. Huh. Rebecca, do you wear the dry eye glasses, the moisture chamber? Or do you wear a different type?
I don't wear them very much. I mean, I wear scleral lenses all day, and generally when I'm at the computer, I don't have anything on. I probably would and probably should, but I have like a couple pair. I've got stoggles and I've got a pair of like safety goggles that I put on sometimes at the computer. It just varies, but where I need them most is outdoors. I mean, I tend to wear either the 7i or the Wiley X ones with the foam shields in them outdoors to be windproof. Driving to, yeah, everybody's got different needs. I mean, and I think to me, they're like the most reliable way to get pain levels down to a manageable place. So you can kind of regain some of your sanity while you're chasing down all the other stuff, the medical sides of things.
Yeah.
Yeah, I think Rebecca, yeah, you had told me that in one of our first calls of just like give your nerves a break, like because I just could not. I mean, even just getting up and walking to the bathroom, that air just coming in. I mean, it was unbelievable how painful that was. And the second I put on, I actually started with Amazon's got a really cheap like onion goggle version that I started with, and it was like $8 and they're very ugly. But I'm telling you, I put those on and I was like, oh my, like I can exist in my apartment and I can go to the bathroom without it feeling like there's like needles flying at my eye when I stand up. So that, I mean, it did make a difference to kind of just let your nerves just settle a little bit.
Well, and when you have prescription glass, when you have prescriptions, that puts a whole nother, twist on it, because then you have to have the prescription lenses put in any kind of glasses that you wear,
It depends where you are and what you're doing, what your needs are. So like,
Yeah.
if you're just at home and don't have company, don't care what you look like, put a pair of safety goggles on, a pair of motorcycle goggles on. You can get dirt cheap things to go over the prescription glasses.
Yeah, that's what I do. I wear the construction, you go to Ace Hardware, I get the ones from there and I put those on over my glasses, the regular ones that they use in construction and whatever.
Mm-hmm.
For the prescription, you don't have to order them with prescription. What I've done is I ordered them without, and I had the lenses made by my local optometrist. So that was a good thing. Also, I think this model, the Sienna Kai, is I think the smallest one. I've tried many others, even just the motorcycle glasses or the construction ones. They were all too big for my face. So for those with small faces, I think this model can be helpful. It's still a bit too large. It doesn't seal quite perfectly at the edges, but it's definitely the best one I've tried.
Which is that one? Which one?
The Sienna Kai, Kai.
Oh yeah, okay. He recommended that. Okay, thank you.
We were so excited when that one came out. I mean, it was years in the making. There's always this big gap out there. Where are the moisture chamber glasses for the women with small faces? I mean, come on, it took so long. So we're very happy that one's out. And also the 7i who make those, they've been making the earpieces all bendable on more and more of their frames so that people can cinch them closer. I mean, yeah. You do have a really small face, don't you, Gabrielle? Because I can see that Kai almost looks too wide.
It almost looks like the Marina one that I got when it was like this big.
It's quite big still, but it's the best I can do.
Yeah, there's a few optometrists that will do, or opticians that will do custom moisture chamber panels on glasses, but it's just hard to find them. Let's see. So do we have Jane? Jane, are you there?
It looks like she's muted, maybe.
Let's see.
I'll try and unmute you, Jane. But you have to accept. So I don't know.
Yeah, just going back to the Moisture chamber glasses in general, it's like when you've got these incredibly hypersensitized nerves, your corneas are just under assault from everything that would never bother anyone else. There's just, it's not like you can figure that out on your own. It's just, you don't know it until you know it. And getting them just sealed in is like, my eyes can relax now a little bit.
Hi. I'm
Hey,
back.
Jane, hi, how are you?
I'm okay. Not a lot of light, but hello, everybody. I've been listening for the entire hour. I had to go to another meeting, but that didn't seem to work very well, so I'm back.
Okay.
Anyway, you've all had a lot to contribute. I appreciate it. A lot of words that I'm not familiar with, like the intense pulse light therapy. I really didn't know how Regeneron works. And there was some new lids, NULIDS,
Mhm.
and the use of the word ocular surface to describe the pain. Well, all of that's going to be very helpful going forward. I have extreme inflammation due to rheumatoid arthritis and a degree of Sjogren's. This inflammation is also in the eyes. And I also learned about the Meibomian gland dysfunction later, after a number of years. Only one ophthalmologist across the river from where I live in the Hudson Valley had the photography equipment. And that's when I first learned about it. And she offered the lipo flow, which a moment of heat wasn't going to change anything as far as I could reason. And of course it didn't, not for me. Later, I met a wonderful doctor who believed in Blefex and cared a great deal about people with dry eye. For a while he was at this ophthalmology group, I benefited from the Blefex treatment because he was squeezing out of whatever glands I had left, toothpaste-like stuff. I couldn't see it right away, but later he was able to show me. And there was some improvement, actually. When he left, no other doctor picked up on it, and I was no longer grandfathered in at a lower price. So the price became extremely high. I kind of backed off from it for a while, which I shouldn't have. I've now lost more glands, but I'm going to continue with the Blefex. There was a side trip that I had to take with the eyes. First, it was cataract surgery, and 2 weeks ago, I had a vitrectomy, where they vacuumed out the vitreous humor, the vitreous fluid, and with it, an entire screen of gangly type myopian floaters, which were obscuring my vision. They also did a biopsy of that fluid to see if there was any underlying disease. And of course, they discovered what they called lipocytes, which were there fighting something, and they believe it's fighting the inflammation. There is another scenario, but they're going further with the biopsy, and I won't know the answer until next week, and that is, could the lymphocytes be there for a lymphoma condition, which is not a happy thought. Lymphoma is a cancer. You don't want cancer of the eye. But I feel very confident by my own intuition that it's inflammation that's brought these lymphocytes to to their attention, and not a more disastrous diagnosis. So I've been living with that. The vision is clear now. They had a bubble along with saline solution. So it wasn't a complete gas bubble, which is what they use to keep the shape of the eye. Because they're taking out fluid and they're putting in saline at the same time, sometimes you need the support of a gas bubble, which dissipated within a week. It got smaller and smaller and smaller. until by the time I saw him 2 hours before my appointment, it was gone completely. If not for my wonderful husband, I don't think I could have gone through all of this on my own. I really, I would have had to, but I traveled to Manhattan 60 miles away in order to take care of the vitrectomy. And eventually I might do it with the left eye as well. And I'd had cataract surgery, so that was for long distance lenses. So it's been almost a year and I haven't yet been able to get prescription eyeglasses for reading and computer. These I got offline, and I also got the goggle glasses, which are much too small for my face. So, 180 bucks. These are 180 bucks. Am I wrong? Have you all had to pay that?
Yep, that's about
Yeah,
right.
that's about right. So I really object to the out-of-pocket cost. I also get the autologous drops, which are the serum drops. Initially, I really found them to be very helpful. I continued to use them. My objective was to protect the cornea from the constant irritation. And then, of course, Sustain Plus, and I'm almost done with my scenario. That has been very helpful, but I put all of that in the refrigerator, and the cooling effect of that, and I carry it with an ice pack wherever I go, the cooling effect is very helpful. And the Sustain over the counter, which is without preservative, I find that helpful. But I'm not as far advanced as many of you. I don't know what the hypochlorite treatment is. Somebody mentioned that. I don't know if it was you, Rebecca. But
Yeah, it's just one of the eyelid cleansing product types.
Oh,
yeah.
Is it a wipe, or do you rinse your eye with it?
It's like a spray that you spray on your lids, or you spray on a pad and wipe it on your lids.
Oh, okay. Okay.
It's a
So
really
that's
simple antiseptic type of thing, really. Yeah.
well, and the IPLs, which Aiden was kind enough to send me, mean intense pulse light therapy. I think Ruth was talking about that, or was it Tracy?
Yeah,
I'm not
few
sure.
people, let's see. Yeah, Tracy too, and Gabrielle too, I think. Yeah. That's, yeah.
So that's, yeah.
People that have done LipiFlow have moved on to IPL and kind of stuck with that a little bit more over the longer
How does that work? Because I have light sensitivity. I'm seeing an IUV specialist, retinal specialist at the New York Eye. Yeah.
I've never had IPL, but my understanding is they put shields over your eyes while they're doing that.
Oh, that could be helpful. It's very painful with the light.
I am so happy about your floaters, and part of me is ever so slightly jealous because I have those masses of them too.
Oh, do you?
Really
Don't
good.
be yeah, you, Rebecca, put me in contact, and the others might be interested if you're dealing with these floaters, with the vitrectomy floater Facebook group from the UK, out of the UK. They were great, and they even researched my doctor, only confirming what I felt was that he was a very good retinal surgeon. And, even removing the vitreous fluid allows them to get a clear view of the retina. If there's a detached retina, if there's bleeding, if there's anything, they go in at that point with one of the openings they've created, the incision. They go in with a flashlight, they go in with a vacuum cleaner, they go in with a YAG laser if they need it. And at that point, anyone with that problem, and you would usually know in advance from the photographs they can take, you wind up with a gas bubble where you must keep your head down through several weeks of healing. That I was hoping would not be my scenario. And it wasn't, but
So glad. Yeah. And my fingers and toes are crossed for you for the lymphocytes. They're for good reasons, not bad reasons.
Thank you. Thank you. I'm hoping to get help, and I'll look into dry eye, whoever they have there as a specialist. Anything I can learn, I will share with everybody who's been so great here tonight.
I'm glad you were able to make it. It's great. Connected in. All right. I think it's 4:45 here. I think we're going to go ahead and wrap up. I just so appreciate all of you. It's just been a really, really good time. Aiden, I know, is gonna remember all the things that I forget.
Sure.
Yeah.
I'll just put one link in the chat here. It's dryfoundation.org for more information. We've got our calendar of the next events for this month. Next week will be a support group session. So just kind of like this, where we all chat with less of a specific topic. Week after that, and it's Friday at 10 a.m. Pacific, which is not a normal time. Week after that, we'll have a panel discussion on corneal exposure. And then the last week, last Friday in June, we'll also have another support group session. We're always available by phone and email. It's, maybe Rebecca, you could put it in the chat, 800-484-0244 and info@dryfoundation.org. And if you are interested in supporting Dry Happy Hour going forward, anyone who's watching now or in the future on the YouTube recording, you can also donate on our website.
I just want to thank you, Aiden, for being there, answering all those questions and stuff. And how many men are affected by this? We seem to be predominantly women. Aiden, do you have the dry eye problem?
Nope, I don't.
See? So what's going on with that? I mean, it's a misogynistic disease. What can I say?
We're supposed to have a lot to do with it, I've read. So yeah, I think hormones have a big impact, especially for postmenopausal women. I think dry is much more common in this group.
Very
So
good.
I don't know what's happening with us younger women though.
It's the computers, I do think.
Yeah.
Yeah.
That's changing. I mean, yeah, it's always been, statistics has always been heavily in menopausal women. I say, but now, I mean, there's so many drugs and surgeries that are causing dry eye, and then we've got computer use and got other environmental stuff going on.
We're just glad you're here. I couldn't believe it when I saw your website.
We do have men, and we've had men in some of the group sessions too. We had a young guy in last week's that's a regular. I can't remember, maybe mid to late 20s.
I actually talked to quite a few men on the dry eye support groups on Facebook. They're out there. Maybe they don't want to be on the recordings, but
Okay. Well, thank you so much.
All right. Well, thanks everybody, and we will see you again another time.
Bye, everybody.
bye.
That's
Thank
nice to
you.
And